Hi, so today I'm going to be talking to you about why do you want to continue to do your maintenance after you've graduated from your therapy program? Well, before I get into this case that we have that's going to be a good reason why you want to do your maintenance, let's talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. We can still help you if you're not local. So it's important that you go to our website and you click on the schedule a consultation button and schedule a time to connect with me and talk about how we might be able to help you. Now let's talk about this case that I have in front of me. This is a young child who had an eye turn, also has amblyopia in one eye, graduated the program, and then was going to get some glasses from his local eye doctor. The local eye doctor was worried because, oh my gosh, the eyesight diminished and all of a sudden there's a really strong lens prescription. Oh my gosh, what happened? Well, I'll tell you what happened. They didn't really follow the routine and continued to do their maintenance activities after vision therapy. Well, but Dr. Julie, you solved the problem, and so why should we have to do any maintenance? I mean, if it's solved and you corrected it with the brain, isn't that good enough? Isn't it done forever? Okay, well, after you wear braces, do you just throw away your retainer or do you actually wear your retainer? So you want to think about it that way. Also, if you lose weight, let's say that you worked really hard and you decided that you needed to get in shape and you lost 20 pounds or 10 pounds or 40 pounds or 100 pounds. You wouldn't just suddenly go back to all of the things that you did prior to that weight loss and health journey. Or would you? Because you would go right back. That wouldn't make any sense. So in vision therapy, what we recommend is that after therapy, you continue to follow a pattern of maintenance. Oftentimes what happens with kids is that they have learned how to do a new set of visual skills. Maybe if they were amblyopic, they went from seeing 2400 or 2200 on the Snow and Acuity chart to now seeing 2025 or 2020. Well, because the brain has been given a new electrical pattern or new neurological pathway within the brain on processing how to see better and to see more clearly, and also maybe to align and use the two eyes together, it doesn't mean that the brain forgets some of those maybe bad habits or lazier eye habits. And so it just means that those pathways exist between not processing and seeing well with the eye versus processing and seeing well with the eye. So you want to continue to set in, almost like setting in this new brainwave pattern by continuing to do some maintenance, even after therapy. And generally speaking, it's more important to do it for the first year or so after therapy. And some kids will have this set in, just like the rhythm of their heart. They never stop to think about the heart beating, but it's beating on their own. So some kids after therapy have this automated process with their vision. They don't really have to do a whole lot after that. We still encourage you to do maintenance. Other kids, it's not real automated. They have to stop, focus, and really think about it still for a little bit. And that's okay. Sometimes it has to do with age and maturity. Sometimes it has to do with the amount of where we came from and where we got to. And if it was a big enough change, it just means that that's a lot the brain had to learn to comprehend differently in such a short amount of time. Continue to give the brain support in this new habitual pattern so that it continues to keep it. Now let's go through this case. So what ended up happening again, they didn't really do the maintenance. The doctor was like, oh my gosh, the lens prescription changed. Oh my gosh, the eyesight's not as good. I said, time out. Everybody calm down. Okay, we got this. It's okay. Let's get you on a great pattern of maintenance. So I did. I put them back on a pattern of maintenance. I got pretty specific about what needed to happen that they hadn't been doing. And I said, let's see you back in 2 months. Well, today was that 2 months, and I'm really grateful and glad to say that eyesight improved 2 lines, so back down around the point to where it was kind of normally at before, but we're still off a little bit. So it improved 2 lines for that amblyopic eye, and he was doing much better in school, grades, even though that he's an A/B student, but performing better, focusing and staying, still and listening in the classroom better. So all because, again, we didn't really kind of keep up on what we needed to do. So is maintenance important? You bet. It definitely is. And so if you're given a maintenance protocol by us, then you want to follow that. And it's really important, not that you do it all the time, but we'll typically tell you, do you need to do this a couple times a week or just once a week? Or do you only need to do this maybe once a month? And so typically the end result is at some point, we want you to only have to really pull that out once a month for maybe 15 to 20 minutes. But initially, depending on what your diagnosis was entering in, we may say, you know what, you need to do this once a week or twice a week for the next 6 to 8 months. Beyond that, if we feel like you're good and stable, then we'll say go down to once a month. But maintenance is super important. Again, this case kind of proves that point, but I've said it before and I'll say it again. Don't give up continuing to do the things that you need to do. If you got success and you got good results, continue to do what you got, like what got you there in the first place. Now with that, I'm going to say, if you like the video, hit the like button. If you haven't done so already, make sure you subscribe so you don't miss any of our notifications of new videos that we put out. Pass this video on also if you feel like it would be helpful. And don't forget, if you're local, call us at 618-288-1489. Or if you're not local, that's okay. Just go to our website at visionforlifeworks.com and schedule a consultation. Thank you.